Moving on now, the British government will be offering vaping kits to 1 million smokers as part of a world-first plan to reduce smoking rates. For more, joining us live is Raglan Maddox, a research fellow at the ANU College of Health and Medicine. Raglan, I'm scratching my head a bit over this one. Is encouraging vaping as an alternative really the answer here? I mean, clearly health experts in the UK think so, but that's not the message we seem to be getting here in Australia.
No, that's right. I think there's a little bit of confusion. I think to start with, Australia is actually really well placed in terms of promoting smoking cessation. And we've seen sort of a whole range of evidence-based cessation products made available through things like the PBS and other things that have driven declines in smoking prevalence over time within Australia. So Australia is a world leader in that space. And we've also seen really encouraging evidence to look at declines in uptake. So we know that our youth and our young people aren't taking up smoking at the same rate that they have previously. So in Australia, I think we've done reasonably well. There are some concerns in terms of e-cigarette use, and you only have to look at the news cycle over the last couple of weeks to look at the alarming increase in e-cigarette use among our youth and young people and among non-smokers to realise that, there's a chance here or a risk of a whole new generation of people becoming addicted to another nicotine product.
And so, Raglan, how strong is the evidence that e-cigarettes are actually effective in terms of helping people to quit smoking?
Yeah, there is mixed evidence around e-cigarettes as a cessation aid. We know that there are a whole range of really well-documented, robust evidence to products to support people to quit smoking. Nicotine patches, gums, inhalators, sprays. So I'd encourage people to speak to their doctor about some of these evidence-based sort of supports to quit smoking. We also have things like the Quit Line, as well as GPs and obviously bulk billing and Medicare hopefully make access to those sort of evidence-based supports more easily available. It does make quitting a little bit easier. We do have to acknowledge that quitting smoking is incredibly hard. And so anything we can do to get around and support people who smoke to quit and to maintain a smoke-free behaviour is exciting. So I think speak to your doctor, call the local Quit Line if you're thinking about quitting, and make sure we look after our loved ones, our friends, families and others to support them when they're going through that sort of nicotine withdrawal process.
And Raglan, I see in the UK they're also going to be offering pregnant women financial incentives to quit smoking. What do you make of that? Is that good public health policy in your view?
Oh, look, I think, it's a complicated one. I think one of the things that we want to do is make sure we're engaging women of reproductive age, people with a cervix, supports to be smoke-free to start with. If we can encourage all women to sort of be smoke-free and foster that smoke-free norm. We know pregnancy can be a challenging time. There's a lot of change going on. And so throwing in another change like quitting smoking can be even more daunting. So anything we can do to support our expecting mums to be smoke-free and to keep up and maintain that smoke-free behaviour is really encouraging. One of the challenges we have with smoking and pregnancy is sort of the stigma around smoking, and most people know that smoking isn't great during pregnancy and it does cause harm to babies, and so there is a risk of sort of shaming expecting mums around that sort of behaviour. So things like vaping and tobacco products and use of that while pregnant can come with shame and discrimination. So I think anything we can do to support someone to have a sort of a smoke-free, e-cigarette free pregnancy is encouraging, but I'd encourage it to be sort of positive and with love rather than sort of shaming and naming and shaming our expecting mums, because like I mentioned, it is a really tough addiction. Nicotine dependence is a hard habit to kick, and so if we can get around our families and support them, then I think that's the best way to go.
Yeah, look, it sounds like Australia won't be rushing to embrace this suite of measures that the UK is unveiling. Raglan Maddox, really appreciate your time. Thank you.
Thanks very much. Have a good day.